Every patient is precious. Every one of us at the VCU Medical Center believes that and works to make every patient and every patient's family member understand how we feel. Still, the patients add up, and even the most dedicated and knowledgeable medical professionals are going to miss a step, miss an important piece of information, or even make a mistake. The best way to ensure the best care is for every patient and every patient's family member to speak up and let us know if something is missing or simply is not clear.
Well, during your hospital stay, you'll have a team of healthcare professionals that will be caring for you and providing your plan of care. What we ask the patients to do is really be an active participant in their care so that we can make it a safe and pleasant experience. We want you to be active, we want you to participate, and we want you to speak up and speak out.
The patient is the one who 24 hours a day, 7 days a week is taking care of themselves. We're there intermittently, and the best outcomes occur when the patients are there with their network of family and friends to support them, engaged actively in their care, and working with us to make sure that our goals are clearly communicated, understood, and they can carry through with them.
See, hopefully it won't take too long.
How can you be active?
Hello.
Oftentimes, it's just pointing out a mistake. But most importantly, it's getting as much information to your healthcare professional as possible and asking as many questions as you have on your mind. Even information that might seem insignificant at first glance can be vitally important to your safety.
It is very important for you to speak up about any questions you have about surgery, about your medication, or anything that's happening to you in the hospital. So please feel free to read it and ask and speak up and ask any questions that you might have.
This brochure has things for you to think about and also a place for you to jot down some notes. So when your physician or other healthcare team members come to your room, that you can remember to ask them those questions or express any concerns that you have.
The hospital is a big, complicated place. It is, no doubt, intimidating, especially when you're here under stressful circumstances. The more you know, however, and the more you speak up, the better care you or your family member will receive.
Well, frankly, hospitals by their very nature are scary environments. And sometimes that really does mute people's willingness to speak their mind or raise concerns or just simple questions. And that's why it's so important for us to reassure them that not only do we want their questions are absolutely critical to making sure that the services they receive is provided in the most appropriate and caring fashion that can be achieved.
You can do your part to prevent the spread of infection by washing your hands and covering your mouth with tissue when coughing or sneezing, and then discarding the tissue.
And you're right there.
Hi, Mr. Jones. I'm Kathy.
Hi, Peter.
Nice to meet you. And look at this nice young man we have for you to meet right here.
It's important for patients to know who the people are that are taking care of them. All the hospital employees are wearing badges such as the one that I have on today. It has the name and also what category of personnel that you are. In addition to that, the registered nurse, or the RN, will also be wearing an additional identification badge that you see here that says RN.
Patients are also badged and identified so the right patient is treated with the right medication. Still, with all those safety factors in place, it's vitally important that you speak up, even with what seems like the slightest perceived problem.
You probably should foam your hands.
You're
first.
absolutely right. I'll take care of that.
Thanks. Thank you.
Thank you for reminding me.
No problem.
As you prepare for your visit to the hospital, make sure you're prepared to give your healthcare professional every possible piece of information you can. First, write down a list of every concern and issue you have so you can remember to address them with your doctor.
Secondly, bring in a list of your medications, or better yet, bring in your medication bottles. It's not unusual for patients to be on a variety of medications, both prescribed and over-the-counter medicines and herbal therapies and other things that we may or may not be aware of.
Before we get started, did you have any questions with your evaluation with Nurse Diana?
Yes, it says here to give you a list of all medicines, vitamins, herbs, and other treatments that you use.
That's right. So I have here that you're taking Zocor for cholesterol and atenolol for your blood pressure. Are you saying there's some other medications you take?
Well, occasionally, vitamin V and some garlic and
Vitamin E.
Vitamin E.
E, yeah.
Okay, vitamin E. And why do you take that for cholesterol too, or?
Yes, and
Okay.
then some garlic and Aleve for my knee.
Okay, so it says here you do have arthritis. Well, I am so glad you brought that up. A lot of people think that over-the-counter medications aren't really medications because their physician didn't prescribe it. But in fact, they are. Medications like garlic and Aleve can actually cause bleeding.
Additional health and safety information can be found at the Community Health Education Center on the first floor of the Gateway Building. You have the power to control your care and the care of your family at VCU Health System. We want you to have that power and control so you are sure you're getting the best care. And we want you to feel comfortable with the professionals who are taking care of you.
Hello, Mr. and Mrs. Royce.
Yes.
Hello.
Hi, I'm Dr. Price Stevens. Nice to meet you.
Nice to meet you.
Welcome here.
We're partners, but we're a team, and everybody has a role, and we want to make the patients and their families part of that team and be an active team member and not just the recipient of care, but a participant in the care.
Don't hesitate. Speak up and speak out.